It stands for a group of tumors known as primitive neuroectodermal tumors. PNETs develop from cells that are left over in the body from the earliest stages of development of the nervous system. Normally, these cells are harmless, but occasionally they turn to malignant, and they are common in children than adults. They are classified into two main groups: PNETs of the brain and central nervous system, and peripheral PNETs, which are outside the brain and nervous system. PNETs of brain and spinal cord, they are medulloblastoma when they develop in the cerebellum. They are pineoblastoma when they develop at the area of pineal gland, and when they develop from the cerebellum, they are called CNS PNET. And medulloblastoma is the most common PNET to occur in the brain and spinal cord. They have a tendency to spread to the other areas of the brain and spinal cord through cerebrospinal fluid. So even if a patient is having a tumor in the brain and you excise it surgically, you have to radiate both brain and spinal cord to prevent recurrence. And PNETs below the age of 3, those that occur in very young children, tend to be a type called desmoplastic tumors. These tumors are very sensitive to treatment and can often be cured with chemotherapy of its own. Coming to peripheral PNETs, these tumors occur in soft tissues in the body, but these tumors have same genetic change as Ewing sarcoma of the bone. So they are now called soft tissue Ewing sarcoma. This is a histopathology picture. PNETs are highly cellular, showing sheets of small round cells with hyperchromatic nuclei. They progress with neuron-specific enolase expression, then on to rosette formation. The tumor markers, peripheral PNETs arise outside the central and systemic nervous system and differs from central PNETs in that peripheral PNET typically expresses high amounts of MIC2 antigen, that is CD99, and exhibits a highly characteristic chromosomal translocation. So this tumor marker is a must for diagnosing PNET, MIC2 or CD99. Incidence and location. Peripheral PNET is uncommon and overall incidence is 1% of all sarcomas. It can occur at any age, although the peak age of the incidence is adolescence and young adulthood. Most common locations of peripheral PNETs are thoracopubic region, retroperitoneal paravertebral soft tissues, the soft tissues of the head and neck, and the intra-abdominal and intrapelvic soft tissues including retroperitoneum. Incidence of abdominal PNETs. The incidence of peripheral PNET in the abdomen and pelvis, including the retroperitoneum, is about 14% of all peripheral PNETs. So it is a very rare kind of tumor. Coming to treatment, they are very aggressive tumors and it depends on